very good morning. Welcome to the Camnet Breakfast Show. We are happy that you could find time to follow the program. As usual, the Thursday edition is dedicated to governance, policy, and politics. And we will be getting your perspectives regarding national security, how we can boost national security as a country. That's our topic of discussion. I'm your usual host, Patrick Soko, and to just get started with the program, we'll go straight to our first segment we call the Health Corner with the Medical Women Association of Zambia, who are going to give us health tips on various issues. And today we have a good topic for you. Just stick around and follow it as it comes.
Good morning, viewers. I'm Dr. Nancy Mbasela from the Medical Women Association of Zambia. This week on Health Talk, we are talking about lupus. Lupus is a chronic autoimmune disease. So by chronic, we've said it's long-standing. It comes in flare-up. So you have symptoms, they get managed, and then when you have stress through smoking, you can get symptoms again. We also mentioned that lupus is an autoimmune disease, which means that your body sees your cells, your organs, and other parts of your body as foreign entities and attacks those parts of the body. One thing we discussed yesterday was systemic lupus erythematosus. We said it affects Africans the most. It also affects women the most. That is, 90% of cases are in women of childbearing age. We discussed that lupus can present in different ways because it's systemic, so it affects different parts of the body. So we spoke that the patient can present with brain problems such as seizures, a stroke. They can present with heart problems such as heart failure. They can present with kidney problems, kidney failure, hypertension. They can present with blood problems, anemia and bleeding. And they can also present with immunological problems. And in more times than one, they present with a rash. One thing I want to emphasize about the rash today is that another reason that can cause a flare-up is being in the sun for too long. So if you have lupus, make sure you take measures, wear clothes that cover most of your body parts. Make sure that you wear sunscreen because UV light can also cause flare-ups. So today we are going to talk about discoid lupus erythematosus. So discoid lupus erythematosus mainly affects the skin. It is not like systemic lupus erythematosus. But of note is that some of the patients with discoid lupus erythematosus can present with systemic lupus erythematosus later. So discoid lupus erythematosus also affects African blacks, Latinas, Asians more than it affects Caucasians. It is less severe than systemic lupus erythematosus. Usually how the patients present is they have rash on the face and the scalp. So this rash usually comes in a round form and then it sometimes forms scales. One thing about this rash is that it leaves scars. So where there is scarring, especially on the scalp, these patients may present with alopecia. Because make sure you pass forms. This one is mostly affected by smoking. If you smoke, please quit smoking. Then if there's a lot of stress in your life, try as much as possible to avoid or minimize it in order to avoid flare-up. Thank you so much for joining me.
Well, that is our first segment there, the Health Corner. As usual, the doctors do not disappoint, and quite a unique topic, lupus, and just hope you manage to learn one or two things that lupus does not actually associate, it is not friendly to smoking. So if you have such a